The CDC early in December declared this year, 2014-2015, as a flu epidemic. Based on number of cases to date compared to previous years, compared to the aggressiveness of the strains that we're seeing, the number of hospitalizations, number of deaths, pediatric and adult deaths, all can be combined into calling this an epidemic. In the 2012 to 2013 year, 2 years ago, there was also an H3N2 strain that was aggressive, as well as a B strain that also picked up towards the end of the season, that the flu vaccine, while effective, was not as effective against those strains. So we did see a very aggressive year similar to what we're seeing this year so far. An epidemic would be determined based upon numerous factors, not necessarily whether the vaccine is working or not, but based upon the number of people that are getting infected, based on the time of year compared to previous years, the number of people that are in the hospital or unfortunately have death from the flu virus are all reasons why an epidemic may be declared. When people will say, I have the flu, or I think I have the flu, especially this time of year, the flu can only be confirmed with testing, but this time of year, common symptoms such as a fever, body aches, cough, sore throat, sometimes some upset stomach or diarrhea may go into someone feeling they have the flu. With that said, there are many strains of the flu. Each year, the CDC and researchers try to predict what the strains are going to be, and the vaccines that are developed are believed to cover the most common strains that we feel we're going to see in the following year. The flu shot, there's a trivalent and a quadrivalent vaccine. The quadrivalent is new as of last year. The quadrivalent covers 2 strains of type A flu, and 2 types of B strain. The trivalent covers 2 types of A and 1 type of B. This year's vaccine, when speaking about quadrivalent, is covering the H1N1 flu that we saw in 2009, and that's one of the strains. The other one is an H3N2 A strain, and then there are 2 B types of the 2 B strains as well. There is a nasal vaccine that's available to children and adults up to the age of 49. It's a live attenuated vaccine as opposed to an inactivated vaccine as the injections are. Right now, it is not as effective as the injections for this year. This time of year, in any year, there are people that believe that vaccines are effective, and then there are many patients and people that feel that they don't want the vaccine for a multitude of reasons. And when speaking about the flu vaccine, there are many reasons why individuals should get it, and there are less reasons why individuals shouldn't. As a whole, whether it be speaking in the United States or in other countries, the flu is a virus, and no matter what strain we're talking about, is a virus that is highly contagious. It's given to other people via respiratory droplets. Simply coughing or sneezing are the most common forms of transmission. The flu is the leading cause for hospitalization, especially in adults over the age of 65. It's one of the leading causes of morbidity and mortality in this country. The only way to prevent it is to vaccinate. We have no other way to protect or prevent against the flu other than some common methods that we would recommend, such as we would for any common cold: covering your mouth when you cough or sneeze, washing your hands frequently, using proper precautions, trying to take care of one's health during the season so as not to run down your immune system. With that said, I definitely, and any physician would feel that the most effective way to prevent the flu is getting the flu vaccine. Okay. Well, the recommendation period is to get the flu vaccine. How it is given or what one person chooses to receive may vary, but the bottom line is getting the flu vaccine is the most important. Whether getting the flu nasal spray or the injection may be a preference. It seems, at least right now, that the nasal spray could be used in less individuals in terms of age, in terms of other factors we have to consider. But if that is what is available to an individual versus an injection, or if it's a preference, then they should get the nasal spray. Well, much like any other virus, when you're talking about trying to avoid getting sick, yes, one of the largest recommendations for prevention is the flu vaccine. Getting or using other proper precautions, covering your mouth when you cough or sneeze, washing your hands frequently, taking care of your body, getting adequate sleep, drinking plenty of fluids, not running your body down. Sometimes you can't avoid completely being exposed to viruses. Some may say you can live in a bubble or be away from other people, and that is sure a better way if you want to consider avoiding viruses. But there's many viruses out there, not just the flu. So the bottom line is if you boost up your immune system with doing the right things to protect your body and take care of it, and when we talk about the flu itself, because it is so virulent and so likely to cause disease in others, the flu vaccine is still the best recommendation to prevent getting the flu or giving it to other people. As of right now, when talking about other treatments for the flu, other than the flu shot for prevention, one of the common treatments is a pill called Tamiflu. As of right now, there is plenty of Tamiflu to go around. I personally have not seen any shortage in my office, and we are definitely prescribing it for those that need it. In the past, there have been times, the last epidemic we had, there was a shortage of Tamiflu. All I could say is I recommend everyone's kind of stockpiling on it the best you can. If you could get them in your office or you could prescribe them. If you're unable to get it, it's not the end of the world. There are many who believe that Tamiflu may not make a big difference, but there are others, including myself, that if given early enough, within the first 2 days of symptoms, you may shorten the duration of the illness, you may reduce some of the symptoms, and therefore helping people to return either to school or work quicker. So I mentioned Tamiflu as one option. There are other options. In fact, Relenza, which is a medication that has been out for a number of years. The difference between Relenza and Tamiflu, Relenza is an inhaled medication. It may not be easy for all individuals to take, especially if they have any coordination issues or other reasons why they can't take an inhaled medication. There have been many reports and studies that show that it may not be as effective as Tamiflu in certain types of strains, the H3N2 being one of them. So it is a preference the physician can discuss with their patients, but most physicians feel that Tamiflu is the first drug of choice to use when trying to give medication to help reduce the symptoms of the flu. Rapivab is a newer medication that has been approved for use intravenous format for patients that happen to be in the hospital, can't take oral medications or inhaled medications. Right now it is early and maybe too early to tell how effective it is compared to other treatment options, but it is yet another option to give, again, especially to patients that might be hospitalized or unable to take an oral or inhaled form of the medication. So most recently, the director for the CDC strongly recommended physicians to use Tamiflu in patients that are not only diagnosed with the flu, but for patients that you may be suspecting to have flu or flu-like symptoms. So in the absence of a confirmation of the flu, in this time of year, when we are in an epidemic, it's not always necessary to test for the flu if you suspect it. And therefore, in an effort to help decrease the symptoms, the morbidity, and helping patients get back to school or work quicker, it is believed that medications like Tamiflu should be used. So I do concur with the direction of the CDC in this effort. Okay. There are no significant concerns. There are side effects to any medication. So Tamiflu, some of the most common side effects may be nausea, vomiting, headache. There have been reports about whether there might be any behavioral changes or psychiatric changes as a negative effect of Tamiflu. So I wouldn't advise giving Tamiflu necessarily to a healthy patient who has no other symptoms. If a patient has some symptoms that are consistent with the flu or many symptoms consistent with the flu, you have to weigh that out. If a patient does not want Tamiflu for any reason, I would agree. I wouldn't push something on them that they don't need. If a patient can get better and the patient's otherwise healthy, most healthy patients will get better with just time, rest, fluids, controlling the fever and the pain. If a patient is in a family where everybody has the flu and he or she is exhibiting healthy symptoms, it may benefit that person to start the Tamiflu anyway to prevent the flu from happening, or at least the severe symptoms of the flu from happening.